Breaking news this morning, another COVID vaccine has been approved for use in the UK. Health Secretary Matt Hancock says the Oxford AstraZeneca vaccine will be rolled out from Monday.
Well, it comes as Essex has declared a major incident over surging coronavirus cases and reports that doctors fear they could soon face making horrendous choices over which patients get care.
Well, we can talk now to three people working on the front line. Palliative care physician Dr Rachel Clark, critical care doctor and president of the Doctors Association, Dr Samantha Bat-Rowden, and Laura Duffel, a paediatric matron in a London hospital. Good morning to you all. Thank you very much for joining us. I'll start with you, Rachel. Just paint a picture of what life is like in hospitals, because many of us won't have been to a hospital, won't have seen what it's like. We'll have just heard snippets in the media, but you can just bring us up to date with what it's like.
Yeah, so I've just spent most of the last 96 hours on call, and I can tell you that hospitals are like nothing I've ever experienced in my medical career right now. We are overwhelmed with numbers of COVID patients. The numbers are greater than they were in April. So there are no visitors anymore. No one can see what it's like inside a hospital unless you're a relative of a patient who's actually very close to dying from a disease like COVID. And inside, we are working with everything we've got to try and keep patients safe. The numbers of COVID patients are unimaginable. We even have patients inside ambulances who literally we can't get into the hospital because there isn't physically a bed for them to be on inside the hospital. That's how bad things are. And it's worse than April in another important way, which is the patients we're seeing are different. They're younger, a lot of them. We have patients in their 20s, in their 30s, on a ventilator, in ICU with COVID. So literally anybody listening just now, it could be you, whatever your age. This is not a virus that discriminates. It can pick on anybody. And staff are absolutely exhausted, very, very worried indeed about this wave, and just working through unimaginable peaks of exhaustion. You want to stop, you want to cry, you can't, you carry on, you do everything you can. And many, many frontline staff still haven't been vaccinated. So you just know that every hour you're there in the hospital, you're potentially risking your life to be there. And I think the one thing we are just so desperate to scream from the rooftops is this is really, really bad. When hospitals in London are so overwhelmed, they're having to transport intensive care patients to other hospitals' intensive cares all the way in Yorkshire. Things are very, very serious. So we please beg the public to stay at home. Just respect lockdown, stay at home. A vaccine's coming. We don't have to wait long. This isn't going to go on for too much longer, but right now, we're vulnerable.
Yeah, I can hear the desperation in your voice. Samantha, is that how you would paint the picture as well? And do you feel safe at work?
Yeah, I would agree with everything that Rachel said, and I can see she's just come off a 96-hour on-call, so thank you very much, Rachel, for your hard work. I would agree this is what we are seeing in intensive care. Intensive care units across the southeast are full. We've created surge capacity despite that, turned wards into temporary ICUs. We've got ventilators and anaesthetic machines from theatres, which has meant we've had to cancel operations. And despite that, all our surge capacity is now full. We are talking about transferring patients out of the southeast up to the north, as Rachel said. So things are really, really, really bad. So I echo what Rachel has said. If you were thinking about partying over New Year's Eve, please, if you could see what we are seeing on the front line, you would not be considering that. Please just stay at home. In terms of safety, things are better on the front line in terms of PPE. I don't think any doctor really worries about their personal safety. We really only care about our patients, and frontline staff still haven't been vaccinated. And this has led to the bizarre situation where we have frontline clinicians who are not protected, who are going out vaccinating elderly, vulnerable people, and we could potentially pass on the virus. So it's fantastic, fantastic news we've had this morning that we are going to get the Oxford vaccine. How incredible is that? But we absolutely need to see frontline staff protected so we can protect our patients and to stop the high levels of staff sickness that we have at the moment. We're already incredibly thin on the ground.
OK, look, Laura, let's come to you, because I know that, you've been speaking to other doctors. You're on a WhatsApp group, aren't you? I know, with a lot of people. What about the picture from other people? We're hearing, this glimmer of hope with the vaccine when it comes on stream. But obviously, at the moment, there are huge pressures and they are set to continue, aren't they, for some time?
Yeah, I'm on a WhatsApp group with nurses from all over London, and then there's another WhatsApp group from all over the country, and it's the exact same thing that the two doctors have just been saying. It's absolutely awful out there. People are scared, people are exhausted. They don't want to go to work, but they have to because they are obviously looking after very, very sick people. We are short-staffed. It's a massive, massive problem. People are having their annual leave taken away. They're coming in on their rest days to help. Our intensive cares are full. Our wards are full. We don't know what's going to come next. We are begging people to stay at home. Please stay at home. I've got a friend who messaged me this morning. One of her nursing colleagues is now in hospital with COVID, very sick, yet she has to go to work and carry on and look after patients, having not been vaccinated. So the fear factor is just incredible.
We're so sorry to hear of everything that all of you are going through, actually. We will be speaking to the Health Secretary, Matt Hancock, shortly, so we'll be putting some of those points to him. But we're out of time now, I'm afraid. But I wanted just to say a big thank you to all of you for your continuing hard work. I mean, it is plain to see just how tough it is for all of you right at the front line there, for every single one of you who are dealing with what you're having to deal with at the moment. A big thank you, and let's just hope with the news of the vaccine being approved this morning that, there is that glimmer of hope that soon the situation for you at work will start to get better. But thank you to all of you.